Welcome tonight to this webinar, a Zoom meeting about our Masters of Science in Health Information Management. So I'm hoping that's why you're here. You have interest in our program. And with that, let's get started. Thank you to all of you for joining us tonight. I see that we have over 40 people who are participating. That's wonderful. And welcome. So my name is Ellen Carl. I am the academic director for the Health Information Management programs here at the CUNY School of Professional Studies. I have a long number of years working in the field of health information management. The majority of my experience over 30 years working in the field was working in an acute care hospital as a director of the medical record or health information management department. I did that for over 30 years, and then I transitioned over to education. And I've been doing that for about 13 years. And I guess that tells you I'm old. But anyway, so I have a lot of experience in the field. I also have an MBA with a concentration in health administration from the University of Miami, and that BS in Health Information Management from the University of Central Florida. Sounds like I'm probably a Floridian, but I'm not. I was born on Long Island, lived on Long Island for my growing up years, and then eventually moved to Florida. But now I'm back in the New York metropolitan area. I've been an active volunteer and member of the American Health Information Management Association, which is our professional association. That's who we align ourselves with. So I've been a member and volunteer there for many, many years. And as I mentioned before, the majority of my experience has been working in the acute care hospital setting. But there are plenty of other opportunities out there now, and we'll go through some of those as we go through the presentation. But right now, I'd like to turn it over to Dr. Kathleen Kirk.
Hi, everyone. I'm glad you can join us. I am Kathleen Kirk. My background is very similar to Ellen's. I have over 30 years experience working in the field of health information management. I live in New Jersey, and I've completed all my education in New Jersey. I have a PhD in biomedical informatics from Rutgers University, a master's in healthcare administration from the College of St. Elizabeth, and a bachelor's in health information management from CAHIIM University. Before, I was an adjunct professor for many years at several colleges, but before I became a full-time faculty, and I have about, I would say, 10 years as a full-time faculty. I've served as an interim vice president of ethics, compliance, and corporate integrity. I was a senior compliance officer for a New Jersey medical school, a nursing school, and also dentistry school. I was a privacy officer, and as Ellen, I was an HIM director in an acute care facility. And now I'm a full-time faculty clinical professor here at CUNY, SPS, and teaching in the master's program. Okay, so what is the field of health information management? This is a formal definition of health information management. While overseeing documentation practices is actually one of the hallmarks of our profession, HIM professionals manage many other key aspects of health information, including collecting, reporting, analyzing, and protecting health data, which is vital to promoting quality care to the patient. Working in HIM requires really a unique skill set that encompasses healthcare, information technology, and business concepts. Our program mission is to equip you with the skills and knowledge to develop, implement, manage health information and data for quality care, reimbursement, research, planning, and evaluation. HIM professionals are trained in the latest information management technology applications needed and required for today's healthcare industry. Program learning outcomes are measurable expectations and anticipated outcomes. Program learning outcomes are statements that specify what students will know or be able to do as a result of successfully completing the HIM master's program. The program is designed to prepare you to become information management professionals who can work proficiently with clinicians and health services administrators to develop clear and effective health information strategies for the healthcare organizations that you'll be working in, as well as carry out the strategies using a variety of applications. Now, you'll come out knowing and you'll be able to design effective strategies based on concepts of leadership and health information management in administrative and business environments. You'll be able to analyze the impact of privacy and security, ethics, professional standards, and the law on health information. Evaluate public policy and healthcare policy issues and procedures to support not only the US, but also global health information management. Evaluate compliance with regulatory requirements and reimbursement methodologies. Analyze classification systems, clinical vocabularies, and nomenclatures, and the impact it has on the healthcare continuum. You'll be able to create and analyze organizational knowledge and technology applications to improve patient care, and evaluate the rapidly changing healthcare industry by researching the healthcare ecosystem. Now, our program is modeled after the Commission on Accreditation for Health Informatics and Information Management Education, commonly known as CAHIIM. We have modeled our program after these standards. CAHIIM is our accrediting body. It has an international reputation for excellence in terms of overviewing and approving higher education institutions and programs who that adhere to strict codes of ethics and core competency areas. It's a nonprofit organization. It's best known as a marker of great HIM education, one that employers and students alike, when they're searching for programs. Accreditation also offers not only you as students and potential employers some assurance that a degree program provides its graduates with the necessary education. It's particularly important for individuals who wish to seek professional accreditation from the American Health Information Management Association, which is our professional association. Accreditation is highly prestigious and provides increased opportunities for students. Now, CAHIIM's registered health information administrator, commonly known as RHIA credential, is only available to graduates of programs accredited by CAHIIM. And please know our program is in the process of seeking accreditation status. Now, health information management professionals work in a variety of different settings and job titles. They often serve as bridge roles, connecting clinical, operational, and administrative functions. HIM professionals affect the quality of patient information and patient care at every point in the healthcare continuum. Now, here's just a few examples of career options. I can guarantee you there is so much more, but some of the graduates have taken positions as HIM senior management, electronic health record implementation managers for large vending services, health information service operation and senior director, project manager of health information exchange. There's also a data quality manager, and you can also become a chief compliance officer. And now I'll turn it over to Ellen for the admission criteria.
Yep, sorry, was trying to unmute there. So it's my turn again. So some of the admission criteria for the program. So of course you do need to possess a bachelor's degree from an accredited institution. And when we say an accredited institution, we mean a regionally accredited institution, which is really the sign of fully transferable credits from one college to another. Now, there are 6 regional accrediting bodies across the United States, The one that accredits programs in our area in New York is called Middle States. So my hope is that you have a bachelor's degree from an accredited institution. You do not need to have an undergraduate degree in health information management. We do have quite a few students in the program now who do not have an undergraduate degree in health information management, but a little bit more about that in a little bit. We also require that you have a GPA of 3.0 or higher on a 4.0 scale. And this would be from any and all institutions that you've attended. So if you, like myself, I transferred actually from after 2 years in college. I went to another institution to finish my degree. But in my case, we would take the two transcripts and average the GPA from both to come out with an overall GPA. So we're asking for GPA of 3.0 or higher. There is a personal statement required that you would need to write about why you're interested in a master's, health information management. We also require your resume. In addition, 2 letters of recommendation, and the letters of recommendation cannot be from a coworker or a relative. It needs to be from an employer, a supervisor, a professor, but it cannot be from a coworker or a relative. And you may be asked to have an interview. We also, sometimes we will contact students if it's not clear from your personal statement that you understand what health information is all about. We might contact you and say, have you done your research? Have you looked at the American Health Information Management Association's website? Do you really know what this degree is all about? The last thing we want to have happen is that you attend a program and it's really not what you're interested in or what you thought it was. And then we would lose you to finishing the degree. So that's our admission criteria. It's pretty straightforward. For those of you who may not have a bachelor's degree in health information management, these are the co-requisite courses that we do require for students to have. And the reason being is that once you finish our program, our expectation is that you will want to sit for that RHIA exam. And these are the additional courses that you need to have in your back pocket in order to be successful on that RHIA exam. So in our case, at our college, we have a 1-semester course in human biology. Or you could have, perhaps you've had AMP1 and AMP2 in your previous college history. We certainly accept that as well. We also have a course in pathophysiology and pharmacology, medical terminology. We have an introduction to spreadsheets course, and we have a statistics course. The one course that most students who don't have a background in health information management usually seem to have is that statistics course. I guess somewhere along the line, we all had to take a statistics course as an undergraduate. So anyway, these are the 5 courses that we are asking that students have have experience in or have taken in order to be successful in this program. So the good news is this particular master's is 33 credits. We're pretty happy about that. We think that it's a very doable program for working professionals, and most of the students who do come to us are working professionals. So this is a list of all of the courses that we have in the program. It touches, as Kathleen went through and was talking about the learning outcomes and the things that we touch on, all the things that she mentioned is somewhere located in one of these courses. So it is a total of 11 courses, 3 credits each. If you do need to take some of those co-requisite courses, there was courses at the undergraduate level, and you would need to take them there. So this is about our graduate degree tuition. Right now, the tuition for a graduate student, part-time student, is $470 per credit. Or if you're full-time, which is 12 credits or more, it's 5,545 per semester. I would not recommend that. It's a lot of work. But the good news is if you're here and participating and you don't live in New York State, all students in this online program only pay in-state tuition fees. So that's really great news. So there is no out-of-state tuition bump. Everybody pays in-state tuition. So what does it take to be an online student? Some of you may have had, maybe you're still in school and you've been through a pandemic and was sort of had to take some online courses. Some of you may have been in online programs. Some of you might have attended college quite a number of years ago and don't really know, what is it like to be an online student? But really these are some of the keys to being a successful online student. And I'd have to say that time management is really at the top of the list. It's really crucial that you schedule your time during the week so that you get all of your work done. This is not a self-study sort of program. And some students or some folks think that when you're online, you just do everything at your own pace. Well, you do to some extent, but everything is done in 1 week increments. So say your course opens up at 12:01 a.m. on Monday morning, everything for that given week will be due on Sunday night at 11:59 p.m. So you have the whole week. You can fit it into your personal schedule. You can fit it into your work schedule and to get the work done. So that's the convenience of being an online student, but you do need to manage your time within that week. Oftentimes I say to students, you should probably block out time on your own schedule and stick to it. Maybe on Tuesdays and Thursdays, you work on the clinical classifications course. Maybe you're taking two courses, and then the other course you schedule on Wednesday and Friday or whatever it is, but keep yourself accountable, because you do have to be self-motivated and self-disciplined in order to manage your time properly. So those we think are the most important thing to be a successful online student. And for our online learning management system, we use something called Blackboard. It's a very widely used learning management system in colleges all over. There is an orientation that we do before the beginning of the semester so that you could get into Blackboard if you're not familiar with it. And we have certain little scenarios for you to do, how to submit an assignment, how to take a little quiz, just so you know when you get into class on day one that you're prepared and you've at least touched and have seen the learning management system Blackboard. So why should you pick the CUNY School of Professional Studies? Well, we are part of the big City University of New York system, which is a huge system, 24 colleges. There's lots of opportunities for personal growth, job mobility, and upgrading of knowledge. And as I mentioned earlier, we are regionally accredited by the Middle States Commission on Higher Education, which is very important. Yes, so that's that. And who are our students? We like to say they're people just like you, working adults. Some are in career transition, people with their own families, people who need a degree that fits their schedule. And we do have people from across the 50 states and from around the world. At one point in time, there was a study done with all the students, and I think they came up with the average age of our undergraduates, not our graduate students, but our undergraduates. The average age was about 35. So everybody at the undergraduate level is also a transfer student. So, many of the undergrads have been someplace else and gone. Well, they had to in order to get into the undergraduate program, but I'm not sure what the average age of our grad students is, but it's at least 35. So, a little bit about who our student body is. And as I mentioned in the HIM program, I think we are the most diverse in terms of where our students are located. They really are located all over the country. and who are our faculty. So we have very knowledgeable leaders in the HIM community. Kathleen and I both served on our, I served on the AHIMA Board of Directors, our national board of directors, and also in the NIHIMA, which is the New York State organization. And Kathleen served on the board of the New Jersey Component State Association. So we've sort of, this is how you also become successful in HIM. You need to network and know people, even though there's 76,000 credential holders in AHIMA credential holders across the United States. It really is kind of a small, close-knit community. Aside from Kathleen and myself, the other faculty are very experienced HIM faculty members and CUNY faculty members. All of our faculty members have to go through an online training session to learn how to teach online. I have to say that meant that when I started at CUNY, it was much more important that folks go through and take this teaching online. But now many faculty that I've hired in the last year or so have already come to me with extensive knowledge in how to be an online instructor. And so what about student services? So we do have a career services department. They're always putting on programs for students, like, buffing up your resume and how to do a mock interview and these sorts of things. And they're great putting on different programs for students. You will be assigned to an advisor. Currently our advisor for the master's program is Teresa Fazzolino. She handles all of the master's students, but you will stick with her sort of from the beginning until you graduate. We do have online tutoring through a company called tutor.com, and they are wonderful at providing tutoring services to our students. They are run through the folks that run the college board that runs the SATs. So we do have that available. We have a library. We're affiliated with Baruch College, which is another one of the CUNY schools. We're affiliated with their library, but we have lots of resources. Quite a few of our courses in our master's program are what we call open educational resources, meaning there is no textbook purchase needed. We utilize materials from the library that you can use and access through your course, which is really nice. And we do have, of course, a help desk to help with any technological issues students might have with their email or whatever. So these are some of the questions that frequently asked questions that we know about. When should you apply for your health information management master's degree program? Well, you really should apply for it. If you're thinking about January, really get started now. And the reason being is that the thing that takes the longest is getting those darn transcripts from other colleges, and give yourself as much lead time as possible. Once your application comes in and it's completed, which means it has the 2 reference letters, it has all your transcripts, it has your personal statement, and it has your resume. Your application cannot be reviewed until it's all done. So the review committee, the admissions review committee, does not look at it until everything is complete. So it's best to get working on it right away if you're thinking about January. And is the program completely online? Of course, yes, it is all online. There's nothing that has to be done. You don't have to come into New York City. So it is completely online. And again, as we mentioned, do you have to have a baccalaureate in a health related field? You don't need it in health information management. You don't even need it in a health related field. We do have few students in the program now who have a bachelor's in psychology. So, so it does not have to be a health related field. And prerequisite courses. Well, I talked about we're calling them co-requisite courses. It's those 5 courses that students need to have knowledge in in order to be successful in the program and on the RHIA exam. And yes, you can certainly attend the program on a part-time basis. There, you can attend at your pace. We've had some students that start and they're just taking one course a semester. We have couple of students who taking maybe three courses a semester. Depends on you and how much time you have in your personal schedule in order to take a course. Generally speaking, we say that each course you take, you should devote at least 9 to 12 hours a week per course. So if we just sort of round that up to 10, if you take one course, 10 hours a week, two courses, 20 hours a week, part-time job, and so forth. Whereas 4 is 40 hours a week, and you would need to factor another full-time job into your personal schedule. So as far as applications are concerned, they can be found on our website. I'm sure you got to the website in order to register for this webinar. So if you get to sps.cuny.edu and you can find a place, there's a tab there for admissions, and that's where you can start your application. And so this is our contact information, my information, Kathleen's information. This is Teresa, who is the Teresa Fazzolino, who is the advisor for the master's students. Lucas is the director of undergraduate and grad programs, and Felix is the financial aid manager. So we put these here just in case you have any questions for any of us. We'd be happy to answer any questions about, if you think of something tomorrow that you didn't have an opportunity to hear about tonight, or certainly we can go at this point into a Q&A session, because I suspect there's probably some questions that people are asking. And I hope we address most of the things you needed to hear about tonight, but certainly we can go ahead and get started with questions. So Kathleen, do you see the questions?
Sure, I'm going to kind of group them a little bit. What if you already have your certificate in billing and coding? Do you still need to take the co-requisites?
It depends where that is from and if you earned academic credit for it. So we're looking for courses that you earned academic credit in.
Here's another question. I have 3 of the 5 required courses by the time I complete my BS. Can I take the 2 courses, the remaining 2 courses while I'm in the program?
Yes, absolutely. I mean, I'm sorry, I probably should have mentioned that, so thank you for pointing that out. Yes, in fact, some of our students they take, maybe one of the co-requisites and one of the master's degree courses to start.
I think the next question, I think you kind of answered, what does a co-requisite course mean? What if I haven't taken some of the courses listed? I believe there were 5.
Right, there were 5. So we need students to be able to be proficient in those areas. So you can start out the program, you can start out taking 1 or 2. I recommend sort of taking those toward the beginning of the program, because some of the coursework is going to build upon those co-requisite courses. So I would highly suggest that students take them at the beginning of the program. Like I mentioned, if you're going to take 2 classes, maybe take one of the co-requisites and one of the master's courses. We do offer some of those co-requisite courses over the summer, and that's another opportunity to take some of those co-requisite courses.
What if I have a business communication degree? And the other question is, what if I have an engineering student? Am I qualified for this program?
Oh, absolutely. It really doesn't matter what your bachelor's is in. It's just in your case, probably both of you had statistics. I'm just guessing. You might not have taken anatomy and physiology with either of those majors, but we need you to make up those other co-requisite courses so that you can be proficient in all those areas. So this is certainly for anybody in anybody from any bachelor's degree program.
I'll earn my bachelor's in health science after the winter session in 2022. can I still be considered for spring?
Yes,
I think, okay.
yes. Actually, the winter session is considered to be part of the fall semester, I believe. I don't know. If you want to send me a separate email, I will double check on that, but I'm pretty sure the answer is yes, you can start in the spring.
And someone asked, how long does it take to hear back regarding the admission decision?
Well, we do, we do have open rolling admissions. So once applications are completed, the committee will review the completed applications, and you should hear relatively quickly after that. I mean, we've had, I don't know, we really, the committee just really started reviewing applications this week. So now that this information session has occurred, I'm sure we'll have some more applications in the queue. So we're constantly reviewing the applications as they're completed.
Here's one. I graduated in 2018 with a degree from HIM SPS. I haven't taken the RHIA. Would you recommend I should take it before or after the master's program?
I don't know. What do you think, Kathleen?
I say after, but because, you know, it's a great refresher too, you know.
That's true. It is a good refresher. Probably after.
And somebody already asked, does the master's prepare you to take the RHIA certification?
Yes, yes. I mean, that's the intent. And in fact, I know Kathleen mentioned this earlier. Right now, we are not yet CAHIIM accredited. We are in the process of starting that. CAHIIM requires us to be 6 months within the time that we have our first graduates. We're not quite there yet. This program started in January of 2021. So we've had a cohort of students come in January, another cohort of students that started this August. So we're a little too soon to start the full application process for CAHIIM, but once we do, and once we are approved for candidacy, students will certainly be eligible to take the RHIA exam while we are in candidacy status. So we don't think students are at risk of not being able to take the RHIA exam.
This is a question about the GPA. I have a 2.9, but when I finish this semester, I'll probably get a 3.5 in a certificate program. Do you add those two together to average?
Yes, as long as it's academic credit. If the certificate was for academic credit, yes, we would average those together. It wouldn't be average. I mean, if you had 2.9 for 120 credits and your certificate is 6 credits at a 3.5, it's the 3.5. It's not technically averaging. It's really taking the number of credits and dividing it properly by the 120 over your 120, however many credits it is. But it'll probably make you go up a little bit on the 2.9.
I think it will too. This person says, I'm on the last semester of a bachelor's program. Is the program not right for me due to not being in the career field? No, it's fine for anyone who's interested in this particular field. But I would say, do your homework, make sure that this is the field that you'd like. The AHIMA, the American Health Information Management Association, has a really nice career map on their website. You can go to their website. It's ahima.org. and look at the career map. It gives you a bunch of information about jobs available in the field of HIM. And honestly, the field, when I started out many years ago, and Kathleen, I think probably the same, 95% or more probably of the HIM professionals worked in acute care hospitals. That's just not the case anymore. There's lots of opportunities throughout the healthcare ecosystem for people with a degree in health information management. Maybe you want to go back to the slide. There's 2 questions on the tuition. Can you please repeat the part regarding the tuition fees? And the other question is, out of state pays the same?
Yes. Out of state pays the same as in-state. So let me see where that is here.
And they're looking for the, also, how much is it, the tuition amount?
It was, let me see now. I messed up here. You'll get to see us all again. So tuition is, there we go, $470 per credit for a master's course. So every course is 3 credits and it's 33 credits. So you can do your math.
Another question, do I have to finish one course at a time before moving to another course as a full-time student, or, and how
No.
long does one course run?
Oh, good question. So I didn't address that. We use typical 14-week, 15-week semesters at CUNY. So for instance, in the spring semester, classes start on January 28th. They end May, kind of late for college, actually. The third week of May or so is when the course ends. So the fall and spring each have 15 weeks. The summer, we did, so if you have to take co-requisite courses, they may be offered in a 10-week format. We did offer one master's course last summer. I'm not sure, we haven't put together the schedule yet for the summer. I'm not sure if we will do that or not, but there are co-requisite courses that are available in the summer if you need them.
What's the coursework like? Is it challenging?
Kathleen is the instructor for a couple of the classes. So I would probably say yes, but Kathleen?
Yeah, I'd say it's a little challenging. There's papers to do. There's some courses only have papers. Some courses have quizzes. It mimics a lot of what you've probably experienced in the bachelor's, only at a little higher degree. And maybe we should say something about the APA. I noticed that when we started teaching, a lot of students didn't really know the APA formatting for papers, and it's used throughout the whole program. So once you get a handle of that, it makes the papers a lot easier. So it's not, I wouldn't say it's a really heavy duty, robust course. I think we take the courses and the topics at a nice pace. And there are office hours, and I know the faculty also meet with, have appointments if you get stuck on something, or they meet one-on-one with you. So I think I'm confident that it's not that challenging because you have a lot of time. Another one is something, could you put up the what's needed again for the application?
Sure. So this is the admission criteria. Again, so you need a bachelor's degree, 3.0 on a 4.0 scale, personal statement, your resume, 2 letters of recommendation, and an interview may be necessary. So just going back to that 3.0 and a 4.0 scale, listen, 2.9 is pretty darn close to 3.0. So if you're a person in that situation, it would be great to sort of explain in your personal statement if your GPA doesn't quite make the mark. It's a perfect opportunity to put something about that in your personal statement. And we do recommend that students do that. So that would be a good way to segue into, why the GPA less than 3.0.
This person said, I'm sorry for being a little late, and if this was covered, is this a dual HIM and HI program, or is there a separate health informatics program? If so, which one would you recommend?
No, this is only a master's in health information management. It's not an HI. I know that we had a little bit of a boo-boo on one slide where it said health information. It said health informatics, but no, this is only a health information management program.
Okay. are you allowed transferred credits?
Yes, but you know, it is, it's hard to find a one-to-one match with other programs, you know, but if you're in that situation and you are thinking about it and you have other master's credits, send us a copy of your unofficial transcript. We'd be happy to take a look at it and let you know if any of the courses are transferable to our program. We'd be happy to do that.
This kind of goes hand in hand with that. Are there different admission requirements for students who already have a master's?
No, it's the same admissions requirements.
And what is recommended as far as the amount of credit to take per semester? And what can she expect from the workload?
Yeah, you know, students do ask us all the time, especially at the bachelor's level, since they really have to earn 120 credits to get a bachelor's degree, you know, and this is a 33 credit program, but it really depends on you. You have to know if you have the time in your life to fit in one course or two courses. And as I mentioned earlier, we do say that every student should plan on spending 10 hours per week per course. So if you're taking one course, expect to spend 10 hours a week. If you're taking two, 20 hours a week. You just, you know, that, and of course, at the master's level, most likely you don't have any transfer credits. So you will need to, and I know some students want to go faster and they kind of accelerate that, but you don't want to, you also don't want to overtax yourself with work.
This is from a computer science student. Are the co-requisite courses 3 credits as well, and do they cost the same?
They are 3 credits each, and they cost the undergraduate tuition rate, which I don't know what that is off the top of my head, but it's lower than the master's rate. You know what it is, Kathleen? I don't know what it is, but
yeah, I don't.
oh, you do?
There's a question here. Let's see. Do I get credit for employment as a coder?
Wait, no, I'm not sure what that means per se, but you
I think
can't
as
really get credit.
employment, yeah, I'm not like, because we didn't look into if they have credentials or if they don't have credentials, or you know, a medical coder, but are you credentialed is my
Right.
question. And someone asked, could you put up the slide of the courses?
Sure.
And are courses offered in 3 semesters or 4 terms? Can this program be taken year round?
Well, yeah, we have a fall and a spring term, 15 weeks each, and we have a summer. And as I mentioned, there are some co-requisite courses that we do offer in the summer. We did offer 1 master's course last summer. It kind of depends on the demand, because I can't, if there's a lot of people interested in taking a course in the summer, I might be able to run a course, a master's course in the summer. You know, I cannot really run a course if I just have one student who wants to take a course. So it does depend on the demand. But I mean, this may not help us in January, but you know, I do foresee a time where we will be able to run more master's courses in the summer based on the number of students in the program. So
that's a segue to the next question is,
yes.
There's no winter courses.
No, no, winter session is only 3 weeks long. And look, folks, I say this to the undergrads too. I'm not sure how you can remember stuff that you're taught in a 3-week class. And we need you to remember information that we're teaching you so that when it comes time for that RHIA exam, we want you to be successful. So personally, I'm not such a fan of a 3-week course. So because we want you to be able to retain the information that we're teaching to you during any given semester.
Great, yeah. I heard that this program has a collaboration with Baruch College. I'm currently a senior there studying computer information systems and mathematics. Will there be any way we can receive additional funding for this program, given that we're coming from a CUNY college? Are there any scholarship opportunities?
So I'm not quite sure about, we don't really have any official collaboration, we being the Health Information Management Program with Baruch. I mean, we do use their library, I'll tell you that much, but aside from that, I don't know of any other official collaboration with Baruch. I mean, we certainly give, we consider Baruch College our brother or sister college. As far as scholarships are concerned, there's probably a few scholarships that students would be able to apply for at the master's level through our scholarship program, but I can't tell you any off the top of my head that I would say, oh yeah, this is for our master's in HIM students. AHIMA does offer scholarships to students. Once a year, they have a decent scholarship program that students can apply for. And is there any tuition difference? No. Or any tuition breaks? No, there isn't anything. It's the same tuition here as it is at Baruch and all of the other senior colleges that offer master's degree programs.
I like this question. Once the program is CAHIIM accredited, will the tuition increase?
No. That's a good question, though.
It is. I know. I thought it was too. Oops, let's see. Again, another question. Sorry, I apologize for being late, but is this a dual HIIM? No.
No, it is not. No, it's just about master's in health information management.
And could you please put up the prerequisite slide again?
Sure. Here they are. So a 1 semester course in anatomy and physiology, that's our human bio course, a pathophysiology pharmacology course, medical terminology, introduction to spreadsheets and statistics.
And a question, if I'm looking to begin the program in 2023, would it be right to apply now?
I don't think the application's open yet for 2023. I think probably the only thing that's open in the application area is spring of 2022 and maybe fall of 2022, but I'm not sure. I don't think we're going out to 2023 yet.
Is there tutoring available for the RHIA exam prep?
Well, I don't want to say we have tutoring per se, but we do offer, coming up soon, actually, we do an exam prep sort of webinar one Saturday each semester where we are prepping students for the RHIA. We open it up to all other students, RHIA, RHIT students, and just prepping students for those exams. We go over best practices and sort of test taking skills, and we're not reteaching students the content, but we're going over what we think you should know, and then you need to do your own personal gap analysis and to see, what am I missing? What did I miss? Did I not know this? How come I didn't know this about project management or about spreadsheets, whatever it is. So we do that once a semester.
Would it be wise to get some real world experience before applying for the program or apply right after getting a bachelor's? Also, is there research and internship opportunities?
So I think it depends on what you would like to do. If you want to continue on straight from your bachelor's into the master's, I think it depends on you and your personal situation. I know I had a few years gap between I finished my bachelor's and then I went back. I went out and started working, and then I went back from my master's. It's different for everybody. I don't know that I can answer that question directly for you. you can get some experience, maybe try and get a job in HIM and then do your master's.
I think also maybe the question has to do with, would they be competing with people in the course that has the experience? But we have people that aren't HIM trained in the masters, and they're keeping up fine. A lot of it has to really do with your interest in healthcare. Oh, this is a big question. I'm currently an undergrad at Baruch and having an intro statistics course, and I'm currently taking a special topics in finance course on strategic and financial modeling. That is basically a crash course on Excel spreadsheets, GAAP financial statements. Would those two co-requisite courses be satisfied by the two mentioned courses? I have taken already an intro statistics course. Woo, that's a long question. Do you read? What? It's too late. I'm going to have to, I see what he's saying. He's taking two crash courses in the financial modeling that has all to do with spreadsheets. But did you explain the, that they could take the Excel and the,
No, I did not explain that, but that's a good point. So we just actually had, going through our governance structure, we put through a sort of an alternate pathway for the introduction to spreadsheets course, which is if students take the Microsoft, I don't know the exact title of it, but it's a Microsoft has their own Excel exam and also an access exam. And if a student comes to us and says, hey, I did these two exams and I passed, we will accept the two of those for the introduction to spreadsheets course.
yeah,
So
we're looking for the 2016 exam too, not the 2019 Excel. The 2016 is the fundamental, I think.
Right.
That's, yeah.
So I couldn't, I mean, without more information about those specific courses, I mean, we would have to look at it. I can't give you an answer sort of here without looking at what exactly it was, but.
Are there scholarships to the program? Could you do, can you talk about that?
There are general scholarships at the college. I don't specifically know of any specifically for the Masters in HIM. As I said earlier, AHIMA, the Professional Association, also offers scholarships that students can apply for. So there are some available. We have a scholarships page on our website. If you would like to take a look to see what the types of scholarships are that are available, you can look there.
I'm currently attending York College. Will my transcripts be available, or do I have to request them to be sent to SPS?
We do like for you to request them, but we can have them pulled as a courtesy. The admissions area can pull them as a courtesy. But we do like to say, I like to say, if I would prefer that you request them, because then the college knows that you're authorizing them to be sent, and it doesn't cost you anything. So
I'm looking, I don't see, I think I've caught all of it. Oh, about the co-requisites. Let's see, sorry for all the questions, but for these co-requisites, would the undergraduate tuition for those co-requisites, like you mentioned before, be equal in terms of both in-state and out-of-state, just like the master's program?
yes, absolutely. In state.
That's a very good question.
Yeah, good question. Yeah, it is. Everything's in state for online students here at CUNY SPS, which is really nice.
Last call. Anybody else?
Last call. I'm just going to go back to our contact information one more time so you have it. And there we are.
Okay, another question came in. Oh, wow, is this great? The job I currently work for covers my tuition. Will there be an issue with submitting the voucher?
Probably not, but
I don't think so either, but not sure about that.
Yeah, you might want to, depending on who your employer is, you just might want to reach out to Felix in financial aid, you know, they know about all that stuff.
Yeah. I've taken AMP 1 and 2. Can I retake the course for a refresher, or would it be unnecessary to retake?
No, don't retake it. You know, students ask this all the time. You know, sometimes we've had students, mainly in our undergraduate program, say, oh, I took AMP, you know, 20 years ago, 25 years ago. And my answer to that is the body hasn't changed much. So what you learned 25 years ago, it's pretty valid still. But if you haven't had pathophysiology, pharmacology, that will help you with as a refresher. The same with medical terminology if you didn't have that course as well. So
you're getting a lot of thank yous. Great presentation. It's refreshing to hear of proactive governance to create reasonable pathways to meeting requirements.
Thank you.
Definitely, thank you. You're amazing. Thank you. This was amazing. Everything's great.
Thank you so much. You're amazing too. You are amazing for coming out on a Tuesday night and at 8 p.m. Eastern Daylight Time and to join us for this presentation. So thank you all so much for joining us. We enjoyed talking. Oh, one more.
How long are the credits good for? So you said, like, you know, you took them.
Oh, we don't have a limit on credits at SPS. Now there's some places that do have limits on credits. We don't have any limits on credits. So you're good, whatever it is.
Hey, some people are writing, thank you. I look forward to enrolling in the program.
Fantastic.
We look forward to you, Vanessa.
Look forward to seeing your applications.
Yeah.
Thank you so much.
Thanks, everybody.
Have a great day.
Yeah.
Bye-bye.